Hi everyone, this is Dr. Parv and I welcome you to the Kidscovery, the Pediatric Initiative. We are discussing the lectures of pediatric nephrology and let's start with the Wilms tumor. So don't get afraid by seeing a lot of text. I have this beautiful picture which I always use to teach the Wilms tumor. So Wilms tumor is also called as nephroblastoma. Mind you, it is not neuroblastoma, it is nephroblastoma. So people confuse it with neuroblastoma. No, it is not neuro, it is nephroblastoma. It is what? It is nephroblastoma. So in nephroblastoma, it's a tumor of the kidney. So you can expect what? You can expect a large mass, a palpable mass in the flanks. So there will be a large palpable mass in the flanks. There is going to be, because there is a large palpable mass, that's going to bleed also, so it can cause hematuria as well, and of course there will be hypertension also. So hematuria, hypertension and a large palpable flank mass which is going to be there. Now this tumor, which tumor? This tumor, this Wilms tumor, in the histology shows some mesenchymal cells, stroma, some epithelial tubules and some blastemas. Okay. So this is, Wilms tumor is going to have the mesenchymal, the epithelial tubules as well as blastema are going to be there. Okay, so just remember this, these are important. Okay, and of course it is associated with WAGR complex. Okay, what is WAGR? W for Wilms tumor is going to be there. A for aniridia, that means the iris is not going to form properly. G for genitourinary tract abnormalities. R for some renal abnormalities. Okay, it is also associated with Denys-Drash syndrome, also associated with Beckwith-Wiedemann syndrome. Okay, so these are important syndromes with which your Wilms tumor is associated. So Wilms tumor is associated with Denys-Drash and the Drash and the Beckwith-Wiedemann syndrome. So let me just teach you the Wilms tumor. Wilms tumor is also called as nephroblastoma. It's a renal tumor. That is the second most common malignant abdominal tumor. Now this is an MCQ which has been asked a lot of time, that which is the second most common malignant abdominal tumor, and the answer is Wilms tumor. And then they ask you which is the first most common or simply the most common intra-abdominal tumor, that is neuroblastoma. And then children will come to me and will say, sir, neuro means brain, how can it be abdominal? No beta, it is a neuroblast. Neuroblast are the primitive cells which can be there in any part of your body, and the tumor of those neuroblast cells is called as neuroblastoma. So don't you think you have got nerves in your abdomen? You have, na? That's why neuroblastoma is a tumor of what? Tumor of your intra-abdominal most common tumor. But Wilms tumor is the most common primary renal malignancy of childhood. But the most common primary renal malignancy of childhood is Wilms tumor. Wilms tumor is having WT1 and WT2 gene on chromosome number 11. So Wilms tumor, WT1 on chromosome 11, WT2 on chromosome 11 only, is just that, WT1 and WT2, that's it. So it is associated with WAGR, that is Wilms tumor, aniridia, genital abnormalities, and you have got some intellectual disabilities also, the Denys-Drash and Beckwith-Wiedemann I have told you. But Wilms tumor, almost all the cases are going to occur before the age of 15, So what is the initial representation? So understand that the most common initial presentation is the asymptomatic. So actually most common initial presentation is also as an MCQ. You won't believe this, but this is an incidental finding. This is a tumor which is asymptomatic. So incidentally, the children are going to see incidental discovery of an asymptomatic abdominal mass by the parents, okay, while giving the bath to the child or while dressing, okay. So, or the physician might see during the routine examination. But you have to understand that this is a tumor, and this tumor is a renin secreting tumor. And this renin is responsible for hypertension. So it is causing hypertension due to ectopic renin production. There is abdominal pain, I have told you, hematuria, I have told you, abdominal enlargement is expected, and of course anemia from the bleeding of the tumor vasculature is expected. Okay. Also This Wilms tumor, T for tumor, TH for thrombus. Thrombus can also occur, can also get formed. Okay. So inferior vena cava, thrombus can also get formed. Okay. So biopsy is the one which you have to do in order to give the definitive diagnosis. Okay. And chest X-ray should be performed because it can cause its metastasis to go into the lungs. Okay. So Wilms tumor, W is M is a malignancy, is a malignant tumor, and this Wilms is having WILLMS. L for what? L for lungs. Okay, so going to the lungs. Biopsy reveals the blastema, the epithelia, and the mesenchyme. I have already shown you. Coming on to staging, although the staging is not very important, but if it comes as a short note, and then you should know this. So please understand that in stage 1, it is confined to the kidney. Stage 1, it is confined to the kidney, number one thing. So you can remove, okay, it can be removed with the capsule. So it can be removed along with the capsule of the kidney, you can remove it. In second, it is outside the capsule. It is outside the capsule, but can still be safely removed. Okay, so 2 T W O, O means out. So outside the capsule. 2 mein it is outside the capsule. What about 3? So 3 means there is non-hematogenous spread within the abdomen. Okay, it is a spread. Okay, 3 non-hematogenous spread, but it is going to spread. Okay, yeah. So it is going to get what? It is going to get spread. Okay, and in 4, what is going to happen? There is hematogenous metastasis, and in 5, there is bilateral renal mass. So 3, it has got spread, but within the abdomen only. Okay, it is having the spread, but within the abdomen only. So THREE, and this spread is also going to have RE. So this is important. Then what about the 4th? 4th is going to be your hematogenous. Okay, hemat. Okay, so hematogenous spread is in 4th, and 5th is going to be the bilateral kidney. 5th is going to be bilateral kidney. Now, since it is bilateral, it cannot be resected, and in 3 also it cannot be resected. Okay, but in 1 and 2 it can be resected. So surgical resection without the neoadjuvant chemotherapy you can give, but if you are giving the chemotherapy later on, the vincristine and dactinomycin is something which is given. Vincristine and dactinomycin is given for Wilms tumor. Okay. Overall survival rate is good. So just remember vincristine and dactinomycin. So very simple. Wilm will have vincristine. Okay. So this is all about your Wilms tumor. I am so happy to teach you this, and I hope the things did make sense to you. Thank you so much for watching us, and we'll see you in the next class.